Jaeann Ashton is a strategic community and marketing leader with 20 years of experience spanning the healthcare, media, transportation, and education industries. She is the executive director of community engagement for AdventHealth's Central Florida division, connecting with local nonprofit organizations and community leaders to improve the health of our community. She loves building meaningful relationships and creating new programs and partnerships that help our community feel whole. Jaeann graduated from the University of Central Florida with a bachelor's degree in advertising and public relations and a master's degree in communication. She resides in College Park with her husband and 2 young children who keep her very busy with all of their school and extracurricular activities, but she wouldn't have it any other way. I'm thrilled to welcome to the show, Jaeann Ashton. Welcome to the She Believed She Could podcast. I'm your host, Allison Walsh. This show is dedicated to helping you show up, shine bright, and achieve abundant success. Each episode is packed with advice and actionable resources to elevate your mindset, confidence, business, and brand, all while focusing on your happiness, well-being, and success. I am so excited that you're here. I can't wait to get started, so let's get to work.
For the women who do it all, and then do a little more. We're here for you. At AdventHealth for Women, we created the region's only women's health navigation team to make healthcare simpler. Our registered nurses will match you with the right doctors, schedule your appointments, and more for you and your whole family. So you can keep making hard look easy.
Well, I am so excited that you are on our show today. Would you mind sharing a little bit more about yourself with our audience?
Yes, my name is Jaeann Ashton, and I am the Executive Director of Community Engagement for the Central Florida Division of AdventHealth.
Well, and I'm super excited about our conversation because AdventHealth's response and proactive approach to making sure that our community's needs are met is so profound and so evident in everything that you do. And you have a big part in that process. So would you mind sharing more? We're going to get in deeper on the community health needs assessment that was just completed and really what that looks like. But can you just share more for our audience that maybe is not familiar with what that looks like before we jump into all of our good questions?
Yeah, absolutely. So every 3 years, we join together with other healthcare entities in Central Florida to conduct a community health needs assessment, or CHNA as we refer to it. And we really survey the community and we ask, what are the needs? What are you seeing? And we drill it down by zip code. So we know that, there might be some larger things overall that bubble up, but then there's specific needs by zip code. And then from there, we build a community health plan by campus. And AdventHealth will really focus on 3 priorities that we feel like we can really move the needle. And we'll do that over the next 3 years. So we just finished the 2025 CHNA, and so we have set our priorities for 2026 through 2028.
Which I'm super excited to jump into all of that. But before we get into that, I'm curious for our audience that's listening, how did you get into doing this work? What's a little bit more of your story?
Yeah, so we go back to when I was in college. I went to the University of Central Florida, go Knights, and all of my internships were at nonprofit organizations. I felt like that was my calling, that I wanted to be doing mission-driven work. And so I had the pleasure of interning at several local nonprofits, and then I worked at UCF for a little while. I got my master's degree, and then I worked at the Winter Park Chamber of Commerce. So had a few different nonprofit experiences. I did dabble in the for-profit space for a little bit, but then I found my calling to come back into the nonprofit space at AdventHealth. And so love being able to work in the community, partner alongside the community, and feel like what I'm doing every day is actually making a difference. And I also love that I get to bring my kids along, because there's lots of opportunities for volunteering in the community and attending events. And so that's really important to me, that I inspire them to give back. And so I'm able to do that in my role.
Well, and Advent is just incredible when it comes to really embracing the communities in which they serve. And I think it's so evident in, the proactive approach to what we're going to talk about today, but just really embracing what it is that especially Central Florida needs, right? And there's just such a strong presence of AdventHealth throughout our community in so many different ways and shapes and fashions. Like, you all always show up, and it is really appreciated. And I think it's something to really look at as from an organization that could just do what they do, right? And take care of people's health, but they are very invested. And I love that. So I'm excited about today. So 3 main priorities came out of the CHNA. Would you mind sharing what those three are? And then we'll get in a little bit deeper.
Yes, absolutely. So mental health, maternal and fetal health, and then access to really basic needs such as housing, healthy food, and transportation.
Okay, great. So now that you have these priorities, what's the process like over the next several years as you really implement? Let's start with mental health.
Yeah, so mental health was actually a priority in our last cycle of the CHNA. So we have the great opportunity to build on some really good work that we've already been doing. And we felt that we had such good momentum with some of our community partners that we felt like we had more to do and more opportunities. So that one, we're going to get to kind of double down on some of the great work that we've already started. With maternal and fetal health, we deliver over 14,000 babies a year in Central Florida. And we know that if you have access to prenatal care, it has a huge impact on the health of you as well as your baby. And so we felt like we have access, we have the population, we know what the moms need. So we felt like we could really make a difference in that space. And then we know that you can't feel whole if you don't have basic needs like transportation and healthy food. And so, again, we've done a lot of work in that space, but really being able to double down with some of those partners and then also find some new partners that are doing this work that we haven't maybe worked with before, that we can invest in, that we can support, whether it's financially or whether it's volunteering. We have lots of different options. Central Florida has so many great organizations that are on the front lines doing great work.
I could not agree more. And again, I love your approach where it's like, we don't have to build it all ourselves. Like, let's find others that are doing it really well and be the connector, that facilitator that allows just the infiltration of resources into underserved communities and others that really need it. So I would love to just double click because I know we're going to dedicate a whole episode to all the things on the mental health front, but let's talk about that a little bit more and some of the things that you have been doing over the last several years. I'm a huge fan of all of your efforts and initiatives, but I'd love for those that haven't heard about it yet to get caught up to speed.
Yes. Well, thank you for being a mind leader. We appreciate that so much. But yeah, so we've got several things. We really saw a huge need coming out of COVID. There was a shortage of mental health professionals, specifically in the youth space, and the youth were particularly affected. And so we received a generous grant from Dr. Phillips Charities to help address that need by way of providers. So pediatric and adolescent psychologists, psychiatrists, licensed clinical social workers, mental health navigators. And so we started 3 years ago building that practice, and we've added on providers every year. And now we're actually also embedded in some of our pediatrician offices because we know that there's a need there as well. And having that grant allowed us to operate the practice on an urgent care model. So that means that we're able to save appointments every day for kids who are in crisis. Because what was happening is we were seeing them come to the ER, which is not where they needed to be. And so we're able to provide that service, right away. But in conversations with Dr. Phillips Charities and other organizations, that was to solve the need now, but what are we going to do to address the need for the future? And so that was where the Be A Mindleader campaign was born, is how do we help destigmatize mental health for the future generations? And so we have now transcreated that campaign into Spanish and Haitian Creole. Haitian Creole launched earlier this year. So we now have resources in the top 3 languages that are spoken in Central Florida. And we also have research that shows that over the last 3 years, we have really moved the needle on parents and caregivers saying, yes, I feel more comfortable talking to my kid about mental health, and now I know where to go for some of those resources. So we want to continue expanding that partnership and adding more resources over the next 3 years.
Mm-hmm. Well, and the resources that you've made available, everything from the talented team members that you've brought on board. I mean, we love Dr. Gurnani around here. I mean, it's fabulous. And
Same.
Just so many just incredible clinicians, physicians that are doing this work. And again, at meeting people where they're at too, and making mental health resources more easily accessible. So, as somebody who spent 20 years in this industry, in this space, in different capacities, there was always such a challenge of getting access to the right care. And so the fact that you're going into pediatrician offices and you're making it an easier point of entry, it will help more people. Number one, it destigmatizes it because the more that you see it, the more accessible it feels and the less, just distant
Yeah.
and removed. And it's like, okay, well, if they can meet me here, right, and I can get access now, it's going to make it that much easier for me to take that next step, that follow-up step that's so important. So I love that. And you're right. Like sometimes the only access point is the ER, but if we can make it less scary for kids and parents and get them connected to somebody in a different way, their likelihood of that continuity of care is so much greater. Because think about it, I'm sure there's stats out there about how many people go to the ER and then don't take that next step right afterwards. But it's like, okay, well, my doctor, my pediatrician told me, or, this physician that we saw recommended these resources. It makes it that much easier. So I love that. Love that. Love that. So thank you for sharing more about that. And I can't wait to just dig in more on everything Be a Mind Leader when we talk to Jessica.
Yes.
It's, just such a fabulous campaign. And I do echo what you said as a, a little piece of that puzzle and watching it from the outside and participating in a lot of different ways in the community aspect. Like I have seen the needle move and it's so cool, like to watch efforts actually make a difference and how fulfilling it is. Right. And
Absolutely.
I know you love the mission driven work, but so do we around here. That's why we wanted to have this whole Make a Difference series, was to really spotlight organizations that are saying they're going to do something and then doing something about it and really making a difference. So I'm so proud of all the work that you all have done. I know it's a lot.
Thank you so much.
Yeah, this is a huge community to serve, right?
It is.
Yeah, the population
very diverse and very different needs. But we've been very fortunate to partner with a lot of other organizations, including Heart of Florida United Way, the Mental Health Association, because again, like you said, we know we can't do it alone. So we love being the connector and the convener in our community.
Yeah, well, you're doing a great job at it. So I can't wait to see all the things to come. And then on the maternal health side of it, let's talk a little bit more there. Like what organizations are you working with? What's kind of, the plan there as far as really making sure that that need is met?
Yeah. So we actually, earlier this year, we just made all of our prenatal education classes free for AdventHealth for Women patients. We know, again, that access to that care and education really makes a huge difference on the health of their delivery and their postpartum experience. So we're really excited to have that offer out there to the community. And then we've also been partnering with the American Heart Association to provide blood pressure cuffs to moms that have a higher risk for cardiovascular disease, because we know that that can be something that can be very traumatic. And so if they have that access to those cuffs at home, they're able to monitor that need. And then also they have the education to know when they need to come in and when they need to get seen. And we've also partnered for several years with Heart of Florida United Way's Community Baby Shower. They have a community baby shower in each one of our 3 counties every year for underinsured or uninsured moms. And we give them things like diapers and wipes and formula, those basic needs that every mom needs, but are really expensive. Yeah, and then we also connect them with care. We have our health navigators there and our birth care coordinators so that they can be their people. They can be their easy button. So if they need help, they know where to go. And we do similar things with Healthy Start, but really just, again, partnering with amazing organizations in our community doing great work.
Yeah. Well, and the health navigator piece of it, just in and of itself, like,
that could be a whole other.
Oh my gosh.
That could be a whole other episode as well.
Well, and like Doreen over there, I mean, like just the fact that you can make one phone call and get connected to care and you take the stress away from having to navigate what can be challenging. There's so many different factors as to like where you should go based on your needs, based on your insurance, based on all those things. And it's like, they're going to solve those problems for you, make it a lot easier.
Yes, they are.
Well, and that proactive approach to wellness too, right? Like just even the things you were sharing about, the American Heart Association and monitoring blood pressure and all those things, like that's huge, right?
Yeah.
Like when you can empower people and say, okay, you're at a greater risk, but here's how we're going to help you so that it's less scary and when you need to seek additional support and care, like that in and of itself is going to change and save lives. So I love that. All right. So then let's round out on the additional needs that individuals have. Like what are we doing? Where are we focused our energy on? Like what's happening next when it comes to that aspect?
Yeah, so that one's a big one. And there are a lot of organizations that are doing some great work. So we partner with over 200 nonprofits every year. And there's a lot of them in the space of homelessness, transportation, food security. So I won't list all of them, but some of the really cool things that we're doing is we're looking at organizations and we're saying, okay, yes, we can provide funding, but what else can we do? Can we volunteer? Can we have one of our leaders serve on your board? So we have over 200 AdventHealth leaders who serve on community boards, and they volunteer their time, their talent, and sometimes their personal treasure. They also serve as our listening ears. They hear what's going on and they bring that back to us so then we can say, how else can we help? So one example I love is SALT is one of our partners, and they provide showers for our homeless population and people who need it. And so we funded some of their mobile shower units, but then we said, what else can we do? And so we have a member who serves on their board. We donated space on our Orlando campus for one of their offices. And then we learned that the laundry facilities of all of those towels and those shower supplies, it's a huge expense. So we actually launder their towels at our laundry service, at our laundry facility. So again, just wrapping our arms around going beyond just writing a check so that we can truly move the needle and get them the help that they need.
I mean, this is huge. 200 nonprofits that you partner with. And to your point, it's like boots on the ground. It's not just here are some resources to go do your mission and fulfill it, but like we're going to be a part of it. We are actively a part of it, which I love that, because when you can be invested in that capacity, you're going to explore and find other things that you might never have gotten the feedback loop on otherwise.
Absolutely.
Right? And that's where, and I know this from I ran a nonprofit for 18 years, right? It can be hard.
It's hard.
It's really hard.
It's really hard.
And I serve on a lot of boards, and it's like making the ask is difficult, right? And yet so necessary to keep the mission going. And so the fact that you're doing this, I find just, I'm just, again, just blown away by what it is that Advent's doing. And I'm excited to see just what happens as a result of this deeper investment into these core priorities over the next several years. But I'm curious for those that are listening, maybe if there are community organizations that are like, wow, this is amazing. We also offer these services or can be supportive. Like, what's the best process for them to get connected?
Yeah, so we actually have a portal online that they can submit a sponsorship request, but we're also out and about in the community. We're at hundreds of events throughout the year, and we love to get feedback. We love to hear from our community, and so sharing those ideas with us when they see us out and about. But we do also have an online way to easy access.
Love that.
50% of mental health illnesses begin by age 14, yet only 1/3 of parents regularly discuss mental health with their children. AdventHealth for Children and Heart of Florida United Way are teaming up to change this. We're helping people take pride in caring for their minds by empowering them to join our new movement and be a mind leader. We've created resources to encourage conversations around mental health and help shape the next generation of mind leaders. Learn more and join the movement at beamindleader.com.
So I know we talked a little bit about Be A Mind Leader and all of the wonderful things happening there. What are some of the other ways that you're supporting mental health initiatives and the need in this community?
Yeah, we have actually been partnering with the Mental Health Association of Central Florida for many, many years. And in 2010, we opened the Outlook Clinic in downtown Orlando, where we provide free mental health counseling services for the uninsured. We also help with medication management, with group therapy, counseling, and we do this not just for adults, but for entire families and for kiddos. And so we have seen so many success stories, so many patients coming through those doors, and it's really expanded beyond Orange County, and people can come from Seminole County, Osceola County, and so we're hoping that we can continue that and potentially replicate it in other areas.
Well, and that's such a huge gift to a community too, especially navigating mental health resources. I mean, that is not only are you saying, okay, we have this need, but we're going to meet the need and we're going to make it available to all so that access to care is never a reason that somebody doesn't get it, right?
Yeah.
Like, and that's huge.
Absolutely.
So, I mean, that is just such a gift to the Central Florida community, and I hope that it continues to expand too. So,
yes.
When it comes to just everything in the maternal side of things, right? And I know Advent has really invested deeply into this area. We've had the chance to talk to Kristen on the show before a little bit about the 4th trimester program, but can you share more for those listening? What is it and why was it a priority?
Yeah, so actually, Black mothers have a higher risk of postpartum issues, cardiac arrest, and so, or like almost 80% of these incidences were preventable through early education, but also postpartum help. And so we stood up a team of care navigators to walk through this journey with these moms, hold their hand through the process, make sure that they had everything that they needed before they delivered, after they delivered, before they went home from the hospital. And then we followed up and we checked in with them and we said, are you going to your appointments? Do you have the transportation that you need to get there? We saw such great success with this. We had a pilot at Orlando that we've now expanded it to Celebration. And what's super cool is that one of the moms from the program who experienced it at Orlando is now one of the coordinators that is helping at Celebration. So it is like full circle. She has a truly authentic way that she can connect with these moms to make sure that they're getting the care that they need. And again, reducing those issues that we knew were preventable.
Yeah. Well, and how cool for her too, to be able to say, listen, I was in your shoes, right? I benefited from this, like take advantage of this. Well, and it's huge. And, I think sometimes when you can meet people where they're at and you can connect them with individuals that can make their life easier and that understand the journey, right, that they're on.
Yeah.
That can be,
makes a huge difference.
That's all it takes is somebody that is super relatable that can say, I did it. I took care of myself. I benefited from these resources. Now you can too. And let me help you get connected with who you need. So super special. I love that. And then as we just continue the conversation around really that third area of really providing access for those social determinants of health, right? And I know one of the big things that AdventHealth is focused on is making sure that you have all of these things available, but now we have to tell people about them and really educate them. So we talked a lot about some of the other needs that you're meeting in the community. Let's talk a little bit more about education.
Yeah, so we know that one of the factors that leads to being able to afford a car and afford a home is education and workforce development. So we invest heavily in the education space, whether it's providing scholarships or working with school foundations. And one of the cool things that we are excited to see come to fruition this year is our work with the Cristo Orlando High School. They're starting with their very first freshman class this week, and we were one of the founding partners. And yes, there was money involved, but it went beyond that. So we're helping stand up an on-site clinic that will be free for the students and families who go to that school. But we are also one of their work study partners. So we are going to welcome 20 students to AdventHealth facilities, both in the clinical and the non-clinical settings, so we can train them. So hopefully inspire them for a future career in healthcare, but even if not, just give them that experience. And I failed to mention that this school really caters to families who wouldn't otherwise be able to afford this, have this access. And so it's really, again, meeting families where they're at, giving them opportunities that they otherwise wouldn't have, and really helping set them up for success. So things like housing and transportation don't become an issue.
Mm-hmm. Well, and I love that. We say often around here, it's hard to be here when you can't see her, right? And so by these students having access to learn, to have exposure, to shadow intern essentially, right?
Yes.
Like learn from others.
Yes.
It will change the trajectory of their lives.
Absolutely.
And I think that is incredibly powerful, and kudos to AdventHealth for doing that, because that can open people's eyes to things they never thought possible. And to your point, when you educate individuals, you provide them access to education and further support, you can change that trajectory and hopefully prevent having to access some of these other resources in their future because they were able to put themselves on a different path.
Yeah.
So it's huge.
Exactly.
Again, just incredible work that Advent is doing.
Thank you so much.
So before we wrap up the show today, I would love for you to share. We love to ask all of our guests that come on the show, who inspires you, who empowers you, who else should we be following and being inspired by ourselves?
I'm a huge Brene Brown fan. Watched her TEDx series, read her books, actually had the ability to see her present live to our AdventHealth team. So I am just a huge fan. I appreciate how vulnerable she is and how she encourages, especially women, to be vulnerable and use that as our power. I know that sometimes that's discouraged, or it has been discouraged, but I think it's what makes us really succecessful and unique.
I agree. I had the chance to hear her speak at the Mom 2.0 conference this past spring, and she was, it was so good. Like,
she is so good.
Oh my gosh. I've read all her books, right? All of her, Dare to Lead and all of these amazing resources. And I've listened to her podcast and just followed her for years. But there's something about her live in a room, unfiltered, where you're just like,
Yes.
Can I just be your best friend?
Yes, I know. I want to be her best friend too. I took
gosh.
a leadership class where we had to like work through, an issue, and we had video interaction. And I just was like, oh, I wish that she was actually like here in this room because she's really
Huge.
powerful.
Oh my goodness, she's incredible. And talk about somebody who's leaving a legacy, which I love that. And she is going down in history as one of the best. So,
Yes, and she's given such great examples that I have used with my own kids of things that she has told her kids that I'm like, ooh, I need to use that. I need to tuck that away. And then I've used it, and it's really helpful. And then I feel really smart, but it's not me. I got to borrow her work.
Well, yeah, no, similarly, I mean, I took a lot of her leadership work and baked it into team building and different team trainings and things that we did. But I also think, like, as a parent who's trying to juggle a lot, right? Like, I think that she has provided just some almost just permission to be okay with not being perfect as a parent.
Absolutely.
And just like, you're doing a lot, right? You're juggling a lot, and be present when you're with them, but also give yourself grace if you can't be everywhere all of the time. And I know I took that as something as super valuable wisdom out of a couple of her books, and just even her talk at Mom 2.0. It was just a good reminder. Like,
absolutely.
We are doing a lot.
I give myself grace every day, and I tell my team the same thing.
Yeah.
We all get grace.
Yeah, you can't put this crazy pressure on ourselves.
No.
So I'm super grateful for you coming on the show today. What is the best place for people to go to if they're looking for more resources about what you talked about?
Yeah, well, we covered a lot today. So I think probably the best place would be AdventHealthForWomen.com. That's where you can get connected to our health navigation team that we talked about. You can also find a provider, and we have more information about our services, some of the ones that we discussed today.
Awesome. Well, first of all, thank you so much for coming on the show. Thank you for the work that you do personally, because I know you are so committed to this work, but it takes individuals like yourself to really see these missions become possible. So thank you for everything that you do. And again, kudos to Advent Health for all of the amazing work that's happening in the community, because we need you, and it truly is life-changing. So thank you so much for coming on the show today.
Well, thank you so much for having me. And thank you for spotlighting people who make a difference, because Central Florida is a really unique place, and it does take all of us working together. So thank you.
Thank you. And that's a wrap on today's episode. I hope you found inspiration, insight, and maybe even that little push that you needed to keep moving towards your goals. Remember, you are capable, you are worthy, and you are meant for more. Whatever dreams are on your heart, keep showing up, keep believing, and keep taking action, because the world needs what only you can bring. If you loved this episode, it would mean the world to me if you'd take a moment to subscribe, leave a review, or share it with a friend who needs to hear this message today. And if you want to keep the conversation going, please connect with me over on Instagram at Allison Walsh. I'd love to hear your biggest takeaway. We've also got some awesome freebies that we've linked in the show notes, so make sure that you take advantage of them. Until next time, keep believing in yourself, keep shining bright, and never forget, I believe in you 1,000%, and my goal is that you do too. Take care, beautiful. We'll see you next time.